I think every generation is moving, is progressing. They want to do something other than what has already been done.
Hey everyone, welcome back to The Tangent with me, Digital Hoos, and my boy Yas. This podcast is about learning different topics, each of us going on our own, doing some research, coming up with our own ideas, and sitting down and then formulating our ideas through a conversation. Actually, before we start, I actually want to bring up one point. A very, very close friend of mine, and I know he's listening, so shout out to you. I'm not going to say your name, but you know who you are. It said something to me the other day. When we were talking about mental health, he was saying, do you feel sometimes maybe you might offend others or someone else? And I said, that's not how I look at it. One, I don't want to offend anyone. Obviously, that's the last thing we want to do. But this podcast is not about saying that we're right.
No.
At all. We're here to learn. Mm-hmm. And we're learning out loud. So even let's say we said something wrong, I'm happy to learn about it. Yeah. I'd rather be wrong and then learn than just saying I'm always right and then never learning. Yeah. So I think that's very important. I think our listeners do know that, and especially like with me, because from my other podcast, Let's Take This Online, you guys can find anywhere. You guys know that it's all about journey, about learning, and I'm happy to be wrong as long as I keep learning.
Yeah, I think we made it clear from the beginning that it's an opinionated podcast where we discuss issues that are out there, but we also, it's our opinion at the end of the day. So, and it's
us learning. Like I'm happy coming to the table, saying something wrong, and then learning from you about it, and then maybe reformulating my thoughts again. It's just constantly because 100%. It's about the process, not the end result.
Yeah, remember the one we did about the American election? Yes, where I was totally off in terms of what the electoral process was.
Yeah, exactly.
The electoral college. So yeah, absolutely.
That's exactly what it is.
I mean, look, we're not out here to hurt anybody's feelings.
Of course not.
To offend anyone. We're here just to talk.
We're just taking our thoughts and vocalizing them and learning from each other and learning from our guests and
getting another thing that I've really been thinking about in terms of our podcast is one of the things that I think that really makes me want to do this is the impact it has on younger minds. Mm-hmm. Kids from the age of, let's say, 12 to 20, don't think about a lot of these things, man.
No.
They don't even know.
Well, I never thought about it.
Exactly.
When I was younger.
So if you and I can have a conversation and get somebody to start thinking about it at a young age,
100%.
Because we're keeping it very simple. We're not deep diving. We're not going into things.
We're trying to do as much as we can within a 30-minute time span, right?
Exactly.
And hopefully, if that piques someone's interest to learn and go on their own, I think we've done we've done a good job. Cool, man. So what are we talking about today, man?
Today is coronavirus.
It's Coronavirus Day. So you guys all know that it's a real thing. It's not just one thing that's isolated in China. We're recording this on March 14th. So if you guys get it, maybe it's obviously you guys get it maybe in a week. And we're doing 3 parts, so you might get one part this week, then next week, and so forth. Yeah. But no, we're recording this on March 14th, and everything we're talking about is representative of the data and information we have as of today.
Yeah.
All right. So we kind of broke it down to 3 parts. Part 1 is we want to talk about the facts. There's a lot of fake news out there, especially on social media, WhatsApp groups, those WhatsApp chain mail groups, and random information. I get a ton. Yeah. And I'm always like debunking them. So one is just say the facts from actual sources. I know both of us went out and actually got legitimate sources like the World Health Organization, WHO, some doctors,
CDC.
Yeah. And that's what we're here to talk about. Part 2 is going to be talking about the impact on businesses. Obviously, businesses out there are being impacted either positively and some negatively and some positively.
Yeah.
And actually, I do want to touch a bit things about the dooks because I actually was a bit of deep dive into the stock market. I guess part 3 is a bit more lighthearted in the fact, not lighthearted as it sees lighthearted, but lighthearted as in it's more about conspiracy theories.
Yeah.
I love conspiracy theories. We all do, and there's tons about the coronavirus. So the idea is that let's just talk about them and kind of either we debunk them, we think there's any legitimacy to them, and we'll just have a chat about it.
For sure.
Awesome, man.
One thing that I do want to touch on in the second episode is the impact on the economy, the global economy.
For sure.
The recessions that are probably going to happen, and how that's going to affect us.
All right, man. Yes, kick it off, man. Where did you start your research into the facts about coronavirus?
Well, I mean, being in the healthcare industry, it's something that I regularly come across in my line of work. I have to give a shout out to all the healthcare professionals out there. Yeah, man. The doctors, the nurses.
More power to them, man.
The selfless people that are on the front line doing whatever
they're having a really hard time.
No, I mean, and to getting the infection and spreading it into their own homes, probably more than anyone else, any of us in the world. It's a global issue. It's something that all healthcare professionals around the world are facing. And so kudos to them.
More power to them.
You know, there are times where you give kudos to teachers. This is one for healthcare professionals,
100%.
Nurses in particular, that are out there in the front line.
Because they're always also the ones who are a lot less paid than the doctors.
And they're taking care of these patients on a
they're
regular
a lot
basis.
more one-on-one,
100%. So yeah, I wanted to say that. Another thing is that I'm proud to say that the institute, the company that I work for, plus a lot of other companies that deal with healthcare information, are providing free resources for research,
great,
so
man.
that we can come up with something globally to be able to counter this.
That's awesome, man.
Whether it be a vaccine or something else
Awesome,
that
man.
helps. So
That's really cool of
very
you guys.
Yeah, I mean, we touched on a bunch of facts. I'm sure you've done your research. I've kind of touched on some of the things that I've been coming across too. And I think, I'll start off with a couple of points and then jump in wherever, and we'll go from there. So it was reported first in Wuhan in China in December 2019, hence COVID-19.
Yeah.
And since then spread globally, resulting in over 100,000, I think 150,000 cases now.
Yeah, by now.
But about 95,000 cases by March 5th, 2020.
Yeah.
Just goes to show you, from March 5th to March 14th, it's gone up 50,000
Yeah, it's been
globally.
I didn't even feel it was a threat until only maybe March. Like, I heard about Jan, Feb. I thought it was one of those China things, like SARS, right, or whatever that kind of was isolated in that area. Speaking about SARS, I think it's important to define this disease because it's important to differentiate.
Yeah.
Okay, there's a virus and then there's a disease. There's two things. The virus itself is called SARS-CoV-2.
Yeah.
So the virus itself is a SARS-based virus. The disease is COVID-19, which is and then that's what's called coronavirus, right?
Yeah.
So just like HIV is the virus and AIDS is the disease, this is how it is. So just so you guys understand the terminology of it, that's kind of the differentiator here.
Exactly.
Yeah.
And coronaviruses are basically given that name because they physically have almost like a crown around them.
Yes.
And that's why it's called the corona. Corona means crown. And so that's why they've been given that name. Coronaviruses are present and prevalent in many animals.
Yes.
They pass from animal to animal. Rarely, animal coronaviruses can infect people, and then it spreads between people.
Yeah.
So that's where the problem begins.
Yes.
It's a beta coronavirus like MERS COVID and SARS.
Yes.
And all three viruses have their own origins in bats, actually.
Yeah. Actually, is it MERS camels in the Middle East? That's what I was reading. That MERS is really big in the Middle East, mainly from camels. It could be also bats in Asia.
It depends. I mean, my facts here that I'm talking about are from CDC and WHO.
Okay.
But I do know you're right that the Middle East respiratory syndrome is prevalent in camels. I don't know if that's where it originated from, though.
Maybe not.
That's the question, because it, again, travels from animal to animal before it gets to humans.
Yeah.
I think one thing that we need to understand that people, have to be ready for is that these coronaviruses evolve.
Yes.
And one day they can be droplet based, the next day they can be airborne.
That's what's
we have
interesting.
to be very, fluid in terms of how we avoid.
What was interesting between the different sources I listened to, some are saying one thing, some are saying, but they're all experts. I'll give you an example. So WHO report, the one that was from 16th to 24th of Feb, consisted of 25 scientists that went to Wuhan, right, and then studied that. That's the main one they released. So I think they released updates, but this was a big 40-page document.
Yeah, I remember
In that one, so up until Feb 24th, they were saying that it's transmitted via droplets and fomites during close unprotected contact between infector and infectee.
Yeah.
Right? And according to them, airborne spread was not reported at that point. But then when I was listening to Joe Rogan's podcast where he had Michael Osterholm, which is an expert in infectious diseases and epidemiology, he was saying that it is airborne and it's transferred through breath. And he was saying this, but I don't know if it was recorded and released the same day, maybe the week before. So you have two sources, one the WHO, then one infectious disease expert saying two different things.
That's because nobody knows.
No one knows.
The fact of the matter is that we're learning as we go, just like this podcast.
100%.
So nobody really knows the entire nature of this coronavirus. And as it evolves, we're going to find out more and more about different properties and how it's going to evolve to spread.
Yeah.
It's literally like, an enemy finding strategies to to spread through humans. You know what I mean? So we have
really,
to
really
keep
interesting.
an open mind.
Remember that movie, World War Z?
Yeah.
There's a part where there's this young guy who's a disease expert. He was talking about how Mother Nature will always find a way. Mm-hmm. And I feel like we're living that statement.
Yeah, 100%.
We're living that statement right now.
And yeah, I mean, so to keep on going on, early on, many of the patients in the epicenter, the Wuhan province in China, had come to a large seafood and live animal market, suggesting that animal to person spread was from there.
Yeah. They're saying most likely bats. That's according to them is the most likely.
Well, the origin, I think, is what they're saying is bats, but the spread could be from bats to animals.
Yeah, and then another animal. Yeah,
and then because there's another animal, it's I forget what it's called.
Yeah, I know exactly. It's I know what you're talking about. I forgot the name.
It's a weird anteater looking animal.
Yeah, exactly that one. They're saying that could be another one. as well.
Pangolin or something like that.
Yeah, something like that.
So we don't know 100%, but most likely that is the case. But I think the media reported on this particular coronavirus more than it did
pangolin.
Yeah.
So you almost had
exactly.
Pangolin. They're saying this might be one of them.
Yeah. So it's either the bat or the pangolin where it originated, and then it kind of spread over.
Yeah.
But yeah, I was just talking about the media and how it's blown it out of proportion, and I think that's just a testament to the times.
Sure.
A testament to what the internet, social media has grown to, and then that also brings in the whole thing that we're going to talk about later about misinformation and myths and issues that come across.
Awesome, man. Great start off to that. I'm going to touch a bit. I'm going to jump between many sources. Mm-hmm. One being Michael Osterholm on Joe Rogan's podcast. One is Peter Attia, who's a doctor. Even though he says he's not an expert in this stuff, he has a range of doctors around him, and they've been doing a lot of first-party research. Yeah. And he's been actually awesome at dropping these 6, 7 minute, 9 minute videos on Instagram, which are very informative. Yeah. And obviously between the WHO reports. So you touched perfectly on WHO. Mm-hmm. Couldn't do anything better there. In terms of Michael Osterholm, so according to him, this thing is 10 to 15 times worse than flu in terms of illness, which is a bit scary. In terms of Italy, what's going on in Italy, I think, it's a huge learning for the Western world. Yeah. Okay, one thing China did well is quickly start social isolations, quickly isolate people, and you can see the decrease in the infection rates per week. It was around 2,000 plus per week, and it dropped to around 400. Italy was not prepared. One thing Italy did, which he talks about why Italy spread so quickly. One, there's a higher amount of older people in Italy. Yeah. And old people live with young people. They're a very close-knit culture where people, for example, don't leave home. They live all their lives with their grandparents, for example. Mm-hmm. So you have a lot of that. And it's a huge smoking culture. All that together, all that kind of expedited the disease itself. Also, hospitals were very unprepared. Mm-hmm. They were almost at capacity before coronavirus hit. So usually, like, let's say you have 20-30% capacity, you have 70% open. It was reversed. They had 70% capacity. So coronavirus hit, they got full up really quickly. And what's happening is that the doctors and nurses are not being well taken care of. For example, the doctors and nurses who already have coronavirus, if it's not severe, they're asked to keep working. Yeah. And that obviously increases spreads. Mm-hmm. And they're only leaving a small amount of the hospital to non-coronavirus patients, and those people are getting it now too. Mm-hmm. And that's kind of what happened. And they were just very, very slow. You're right. And I think that's kind of what...
You're absolutely right. I think it came to a point in Italy where they were coming in, 10 patients were coming in at once. All the ICU beds were full. Yeah. And they had to basically choose who would be the best candidate to try to save here.
Choose who to not let die.
Exactly. Yeah. And they're bleaching masks and equipment to be able to reuse them. And like you said, while these people that are helping are infected themselves. Yeah. So it's not the right model. No. China, you're right, was amazingly prepared and kept on doing it. You saw how they built that massive hospital within a few days. I think it's also cultural. The sense of urgency in the Chinese culture, or the Asian culture in general, I feel is a lot more than European culture, where European cultures are a little bit more laid back. Sure. Like, whatever.
I think what also helps the Chinese is the government. The government was quick, because the decision comes from maybe one person. Yeah. While in the Western world, it's a more, in a democracy, you have many people, you have advisors, they make a decision, then they have to sit with, like, for example, minister of, like, media, who then has to tell the media and so forth. While China, it's one word. One word, you go.
Yeah.
And everyone does it. And I think this is maybe one of the positives about that kind of governmental
The
structure.
pro of an authoritarian government.
that you can move much quicker than the democratic kind of
It's
government.
crazy. So I was speaking to actually a person that I know through family, who's an epidemiologist in the States.
Awesome.
And he was telling us, a group of our family members that were interested, that basically what's happening is you can not show symptoms and spread the virus
Yes.
for 5 days
Yeah.
before you even start showing symptoms. So
Incubation period of 4 or 5 days.
Exactly. So by the time you're actually showing symptoms, you might have infected through a chain reaction
100%,
20, 30, 40 people.
That's actually a great point you make. Because so when it comes to diseases, there's something called R naught, which is R0, but the zero obviously is not like nautical content, so it's spelled R-NAUGHT.
Okay.
This symbol of R0 is about the infection rates. So right now the coronavirus R naught is at 3.25. That means for every one person infected, he or she can infect 3.25 people.
Yeah.
The average flu, the influenza, is 1.3 R naught, almost 1-to-1. And that is what they're really worried about. Right now, the job right now is to try to decrease that R naught as much as possible.
Right.
And
Makes sense.
so this rate of growth is what's scaring people. So you imagine a graph, right? You have something called concavity, right? There's a downward concavity and then an upward concavity. Yeah. A downward concavity is something like this. So it's increasing, but the ratio is decreasing. So it's like that shaped.
Right.
An upward concavity is like that shape. So it's increasing and it's exponential.
Yeah.
Right now in China, they've reached downward concavity.
Okay.
So even though there's more, there's still new infections going on. It's just the rate of growth is lower.
Decreasing.
In the U.S. right now, it's an upwards concavity, and that's what they're very scared of right now in the U.S. because it's an exponential growth. Last week was 1,000. This week is 3,000. While China last week was 2,000. This week's 400.
Yeah.
So that's what they're really worried about: this infection, this R naught, and specifically the rate of growth.
And rightfully so. I
Yeah.
mean, you think of the U.S. as one of the most advanced medical systems in the world that are being prepared for anything that comes their way. But here is where you'll see that,
Yeah.
I have to say I'm very disappointed in the government's reactions.
Yeah. It was very slow.
Government has been terrible. You can just watch a few of Trevor Noah's episodes and understand what I'm talking about.
Well, he went from last week or something saying he'll never be tested. Now he's saying, he'll most probably will be tested. So, and they went from, it's not a problem. Now it's a national,
Exactly.
epidemic or whatever, pandemic.
It's sad. The level of ignorance and the level of manipulation to try to make everything about them and their party and how they're going to win.
Yeah.
I won't even say their party, just that group of people.
Yeah. Sad.
Anyways, that's another topic to get into another day. But for now, I mean, what you were talking about in terms of graphs and information. The CDC released a number of graphs not too long ago. I don't know if a lot of you viewers or listeners have seen it. I don't know if you've seen it. I'm not sure.
I've seen some of the graphs they released.
And
is it the one that's blue and orange?
Yeah.
That I've seen
the
that.
Black background with blue and orange. Yeah. So those show, actually, just to calm the public down, it shows a lot of what people may have thought, inaccurately about the disease.
Yes.
And clarified a lot of facts. True, it's a massive issue. It's spreading at a rate that we can't even imagine. But at the same time, the people that are most vulnerable to, a lethal outcome due to the disease or the virus are people that are over a certain age, people that have chronic diseases.
Yeah.
And I have to say, knock on wood, kids have been spared for the most part.
That's what it seems. All the experts are saying it. For example, in the WHO report, they're saying that people under the age of 18, we're looking at low, under 3%, 2.4. Even what's called Michael Osterham was saying kids are not getting sick as often. He was saying 2.1% under 19. So it seems under 3% for kids, which is actually really good. But you know what's funny? They really don't know why.
Yeah.
They don't know why.
No.
There's speculations right now. No one actually knows why kids are not getting sick.
But isn't it crazy how nature works?
Yeah.
Like, spare the youth. Let's get rid of this.
Kill old people.
It's almost like population control.
It does have that feeling, right?
Yeah,
Because
right.
you see it in the animal kingdom.
Yeah.
And it's really interesting. One thing that I really enjoyed about Peter Attia, he was talking about the mechanism of transmission. Some people are saying 3 meters, some people are saying 5, some people are saying 6 meters. We're not still sure.
Yeah.
That's something we're still unsure about. So people who are talking about it does seem to survive on surfaces for a long period of time.
Yeah.
Which is why everyone is with hand sanitizers now. So it is ideally is don't touch surfaces because it might stay there for hours, right?
Yeah.
But the transmission, all experts are saying that it's not, like, for example, if you're across like a whole hallway 10, 20, 30 meters away, they're saying that it's probably not going to travel all that distance. It's close proximity, under 6 meters, right? So that's why they're saying also do not be in a lot of crowds. That's why concerts are being. So those are kind of
But that's such a big issue because 6 meters is a pretty big distance.
Sure.
When you're standing somewhere, you know what I mean? Like you and I, we're not even a meter apart right now.
Yeah,
right?
yeah.
I mean, we know each other and we're comfortable. But when you're out in public, and if you're in countries where public transport is the main mode of transportation,
buses,
like North
trains.
America, like Europe, or you're in a country like in Asia, India, and China, where just masses are very used to being close to each other. There's no sense of personal space. It's almost impossible to control those kind of spreads.
That's what they're saying about China. They're a bit worried. Now they're doing this social isolation and it's decreasing. But eventually people cannot stay at home forever.
No.
1 month, 2 months, 3 months. Yeah. Eventually people are going to go back out there. They're saying that at that point it might spike back up again. And that's where they're a bit worried.
Yeah.
So even the social isolation, I think it's just about buying us time. It's not going to be it's obviously not a permanent solution. No one can just stay at home and do nothing.
Yeah. No, the senior gentleman in China who was a spokesman or was someone that was very qualified that dealt with SARS earlier, I forget his name, recently said that he thinks that the global peak is going to be around June.
Yeah.
And then it's going to start decreasing, or pre-June, and then by June,
like
we're going
May,
to start,
June.
Being able to control the virus. I think temperature is one of the key factors.
Yeah, they're saying, but again, we don't know.
Nobody knows. Exactly. They can adapt and evolve to be able to survive.
We hope the heat will kill it, because then people like us in the Middle East, you see, who gets really hot in summer, will feel a lot more comfortable, but we really don't know.
Exactly. One milestone that we hit yesterday, which is a fact, a sad, tragic milestone, is 5,000 people have lost their lives globally now.
Yeah.
Reported.
Yeah.
Right? It could be a lot more. It could be over double. But as of now, what we know is 5,000 people.
That's an interesting point, because Peter Attia was talking about something called case fatality rates. So there's actually real fatality rates and case fatality rates. Right now, for example, always case fatality rates, the ones you hear in the news and reports, are always overinflated. Why are they always especially with something like this? Yeah. Because it takes basically people who died over all the people who get it. Now, it seems because 70 to 78% of people who get it as mild flu symptoms. Yeah. And most of the time, you're not probably going to get tested for that. Right. You'll be at home, you'll isolate yourself, you'll take your fever medication, your cough syrups, and you'll get over it within a week or two, and you'll never report it. So there's might be tens of thousands of people, maybe even hundreds, we don't know, that are just dealing with on their own. Some people get it and don't even know they have it. Yeah. Some people are getting it thinking it's the flu and they get over it themselves. So these people are not counted. So there's always a case fatality rate is going to be a lot higher than reality. So for example, Italy is at 7 to 10% the case fatality rate. But it's probably a lot less, because there's probably 1,000 people who are getting it. For example, I could have got it last week. I could have got it last week and got over it like the flu, and now and then I'm good. Yeah. And I never even knew I had it.
You're right. I think all statistics need to be taken with a grain of salt.
Sure.
There's no way to have a closed group to be able to do that kind of a stat and be accurate about it. So I was reading yesterday's remarks from the Director General of the World Health Organization, posted on the 13th of March, and he starts off very interestingly. Everybody should check this out by talking about how there are so many other diseases in the world. Now, this is a major factor.
Sure.
But don't forget that people still need, emergency care for cancer, diabetes, HIV, malaria,
all these other for sure.
That's out there.
That's a good point.
We can't forget everything.
Yeah, we have a tendency to kind of get diverted, right?
Yeah. And another thing he talks about is what I started this discussion with, which is his respect for all the healthcare professionals. 100%. Then he goes to the stats that he has yesterday: 132,000 cases worldwide in 123 countries and territories. 5,000 people lost their lives tragically. And then he talks about how he's very impressed with the World Health Organization. Obviously, he's
for sure.
They came up with an 8-pillar system to be able to monitor. Or to be able to give guidelines to countries to be able to control it. And these guidelines, if I can quickly touch on the 8, are basically this: that operations, support, and logistics, country level coordination, planning, and monitoring, risk communication and community engagement, surveillance, rapid response and case investigation, points of entry, national labs, infection prevention and control, and case management. So if countries are managing all these together, I think they have a better chance of.
Yeah, one thing, because I think we're running out of time, let's wrap it up. One thing we have to take into account is that it's quite obvious that the world was not ready for a pandemic. We talk about how we thought we were ready, but we were very far from actually being ready. A big point we have to look into that all our major hospital care equipment are all made in 1 or 2 countries. For example, all IV bags are made in Puerto Rico. So when Puerto Rico, for example, had a hurricane, we had a huge shortage around the world. They make 85% of all IV bags around the world. China is responsible for making all the masks, the gloves, right? So when China gets hit, there's shortages of these things. So I think the world was not even ready on pure, equipment. And I think this is something that's going to teach us a lot. One also thing I want to touch about is something called an ACE2 receptor. So it seems that people with higher ACE2 receptors are at risk. You might get it genetically. We don't know what it is, but it seems the virus is gaining access into humans by latching on to the ACE2 receptor. This receptor basically lets this virus kind of copy itself and then split and then multiply. So some people who have low ACE2 receptors genetically, a lot more safer. Yeah, which was quite interesting.
That's crazy.
Yeah. So
human being is an amazing being. So those 8 pillars, I think, are key for any government to be able to manage their spread. And he goes on to say that it's not just not just testing alone, not contact tracing alone, not quarantining alone, not social distancing alone, but all of it.
Yeah.
And governments that are willing and prepared to do that are going to be the ones with the least amount of spread and damage.
So this episode is going to be focused on facts. Let's maybe debunk. I don't want to get into the conspiracy theory stuff because that's part 3. But maybe we'll debunk some things that people are misinformed about.
Sure.
One thing I want to tell people is a lot of people talk about vitamin C and stuff. Right now, there's no evidence. Obviously, it's good to have vitamin C in general. Good to have the vitamin D and stuff like that. But so far, like people who are going crazy on it, no actual evidence of it. Other things, the mask. So actually, when Michael Osterham was talking on Joe Rogan, and many other people are saying the masks could actually harm you in a way. If you're fine. So you always ask yourself 2 questions. Am I at risk? Am I at risk or living with someone at risk? If the answer is no, that's great. Number 2 is, am I in an area where there's outbreaks are being reported, like a direct area? If both of them are no, you're probably overall fine. Just be good precautions. The mask is more about I think is more useful for people who are infected.
Exactly, to spread, right?
Exactly. So the people who are not infected, when you wear a mask, especially the N95, you're actually overworking your lungs.
Yeah.
And when over time, especially if you wear it every day, 8 hours a day, 9 hours a day regularly, your lungs are going to be overworked. Yeah. And then you're actually going to start having respiratory problems, which might actually help the disease get to you. So you have to be conscious about this. So you have to be conscious about these things. Fine, if you're in an area where you feel everyone around you and you really don't want to enter it, fine. But if you're just day by day, I don't think the mask is going to help you really.
I agree.
It's probably counterproductive.
Yeah. You know what I did in the beginning of this whole thing is I did buy a box of N95 3M masks.
Before it spiked?
Yeah. Okay. And because my wife was really paranoid.
Sure.
So, we kind of went that route.
It's good to have in case. Like if you have to travel, like I think about it this way. If I'm going to if I know I'm going somewhere and I know there's going to be infections there, I'll even wear gloves.
Yeah. I even gave one to my mom last night. She flew back to Canada from here. Yeah. I mean, there's no real particular risk, but at the same time, I said, you know what, Mom, take this with you. If you feel the need for it, it's with you. Sure. I've given it to you. It's up to you if you want to use it or not, but don't keep it on all the time.
Yeah.
And you're right. The masks, I think, are particularly useful in terms of the infected person spreading it to others.
So you're saying the mask is really, really more useful for the person who's a healthcare worker.
Excuse me.
Speaking about masks, and it's more useful for those kind of people. And right now there's a shortage. I know that 3M, for example, has upped their production of it, and they're not increasing the price, which is really great. But obviously there are people who are really abusing this situation.
That's something we have to talk about.
We'll talk about in part 2. So we'll leave that for then.
It's basically with every virus, the idea is find, isolate, test, treat every case, and break the chain of transmission.
Yeah.
So these, particular facts are the best in terms of curbing it.
Yeah.
I think another very important fact is what the stats of this virus, as not obviously later when it evolves to something else, but right now as it stands, are compared to something like, for example, MERS or SARS. SARS has taken a lot more lives.
Yes.
If you look at it.
No.
SARS was higher in terms of the infection rate too. So, in percentages, we're still not there. So
No.
panic needs to be calm.
Yeah.
Calm down a bit. But
One thing about SARS actually was SARS was living outside of the human body for days. We're still unsure about the COVID-19. We're just not sure. It might be days. It might be less than days. In terms of living outside the host body.
Right.
And that was also what made SARS particularly dangerous. Right? People who are probably more at risk, just so you guys know, smokers.
Yeah.
So if you're smoking, try not to.
Absolutely.
People who have smoked, so that's me and you. But good thing that we've stopped.
Yeah.
Diabetics, type 1, type 2 diabetics. People over 70.
Yeah.
But I think if you're healthy over 70, I think you're overall pretty good. But especially if you're they haven't been the best of health and you're over 70, be careful. High blood pressure.
Yeah, that's
people
me.
at risk. People who have, again, like I said, a lot of ACE2 receptors that you can't really test for that. You
there's
can't
no way
test for
to
that.
really tell, is
Unless
it?
you do it, I don't know, some genetic test. I don't know. So obviously, then healthcare workers are the most at risk.
Yeah, of course.
So that's basically it. But if let's say you're young, in your 30s, you live a relatively healthy lifestyle. You should be, don't over panic.
Yeah.
Even if you get it, your probability is on your side. We're talking about 70 to 80% of the cases of people at that age, 30, 40, whatever, even the 50-year-olds, 60-year-olds, are mild symptoms. You might get a flu, get a fever, get a cough. Don't over panic. They're actually saying it might be best just to stay at home. Don't even come to the hospital, because hospitals, you might infect more people.
Yeah.
And people are there with low immunity, or you might not have it. You might have had a flu and then pick it up in the hospital.
Yeah.
So if you just have the basic flu symptoms, just isolate yourself at home. Take the cough medication, something like that,
Exactly.
and you should be balanced. You should be fine in a week or two. Do you find anything? I have yet to find anything in research, anything tangible. Is that if we get it and get over it, will we never be able to get it again? Will we have the antibodies?
I've been looking for that too.
I can't
and
find
I don't
it.
think we know yet.
Okay, fine.
I don't think we know yet. What I did learn from that epidemiologist that I spoke to from the States was that he said that most likely what will happen is somebody will get it in 3 phases.
Okay.
So you get it and you'll have regular flu symptoms, and then you'll feel like you're getting better.
Okay.
And then it gets worse. And in the
Okay.
second phase, you'll feel a lot heavier in the head. You'll feel fever,
Like
heaviness.
pneumonia-like.
Yeah, it's almost at the pneumonia level. And then the third phase is where it's like you're breathing with one lung. You can barely
Okay.
breathe. You get up and you're out of breath, and that's where it can turn into a lethal situation.
Yeah, but most people stay at phase 1, right?
Well,
As per that's what they're calling mild.
based on the mild,
Yeah.
the spike in mild
Yeah.
cases.
70-78%.
But in every case, what I found was interesting is the people feel like they're getting better between each phase of the 3 phases. So it's very almost deceiving in the sense that if you're staying home from work and you didn't know, you got a flu, you're like, yeah, okay, I'm better now, and then you go back to work for one day, and all of a sudden you're hit again at the second stage or phase, and then it's just massively, difficult on you, and then you've already spread it to so many others. So it's crazy.
Yeah. So I was actually reading about what airlines are doing. I'm actually kind of impressed, and I hope that what they're doing. So, for example, locally, because those are the ones that we see, Emirates, Etihad, Air Arabia, for example, they've upped the way they clean planes.
Yeah.
So, for example, the smaller planes, for example, are getting a 16-person team that do an hour of cleaning.
Yeah.
And then the A380, the big planes, get 36-person team do that. And if any plane, for example, had or suspected to have had someone with COVID-19, they do a 10-hour cleaning, 8 to 10-hour cleaning. They've actually upped the filters in their AC because it's all recycled. They're worried about it. So it does seem that air travel is being taken care of seriously.
And it needs to be.
100%.
They're closed in a plane.
Well, they're also losing, if from a pure business side, we'll talk about it, they're losing money, so they have to.
Yeah.
One thing that's not very good, and that's why, and I think it's what we say is cruise ships. Cruise ships are doing a horrendous job. One, I didn't know this until I learned it, is that I didn't know that all the air in the cruise ships are complete. I thought they actually have like proper generator. They're all recycled, and they're recycled without proper filters. That's why you always hear about these outbreaks on cruise ships. I always wondered why. Why always people getting sick on cruise ships? It's mainly because of the air. Right. And what happened? There was a couple of cruise ships that hit it, and they're doing the worst thing. Instead of getting the people off the ships. Yeah. They're leaving people. They're quarantining people on the ship. So even if you get, let's say it's 1,000 people, 2 people have it, they quarantine the whole ship. Yeah. All you're doing, those people are breathing to the air conditioning, and then they recycle the people who don't have it. Exactly. And then more and more people are getting it. They should have got people right off. Mm-hmm. So
even if you're in an enclosed compartment, you're still breathing the same air as the person in the third compartment.
So let's say even if infection is 4%, you're constantly breathing it. So even if it's 4%, it's 4% this day, and next day, and next day, and then eventually you're going to get it.
Yeah, isn't that ship, what's it called? Emperor Princess?
Yeah, something like that, what it's called.
600 and something cases?
Yeah.
Unbelievable.
So if you take that over the population of the ship, we're over 50%.
Yeah, the CDC or WHO monitoring or the World Monitor Program shows like nation China, Italy, Iran, U.S., whatever other countries. I don't even know if U.S. is up there. And then all of a sudden it's the Emperor Princess or whatever, and it's a cruise ship.
You know, so funny enough, you mentioned Iran. I want to talk about Iran.
Iran's not equipped, huh?
The numbers are still not out there, but it seems really bad. Yeah. Obviously, one, you have ignorance. And, for example, you have the supreme leader, Ayatollah Khamenei. He basically said, don't worry, it's not important. We'll get through it. Let's not exaggerate it. It won't affect our country for long. That's the wrong way of thinking.
Are they using the fold of religion on that?
Well, because there was actually, I forgot his name. There was one mullah in Iran who said this disease was to eradicate the Chinese for their sins, and then he got it. So there's some karma there. But that's a serious
part 3. We have to talk about all those myths.
But one thing would be, because there is a shrine in Iran. It's a holy center. It's called the Hazrat Masumeh Shrine. It's visited yearly by millions of Shia Muslims. They're not stopping it. So we're talking about millions of people congregating in one spot.
You can't do
That's very, very scary.
That's one thing I have to commend or give kudos to the Saudi government is that they stopped
the pilgrimages.
Yeah, and I mean, that's never happened in history before. I don't know if they completely stopped it. There was news that they were still allowing it in a more bordered area.
Sure.
But regardless,
they've done something.
They disinfected the area, what they call the mataf, the area that they do the tawaf in, or the circles around the Kaaba. And what else I saw yesterday is they actually changed the call for prayer in Kuwait.
Okay, I see.
Okay, so apparently there is some sort of a saying of the prophet from the past that says that in cases of storms or epidemics or pandemics, you can call people to stay at home to pray as opposed to come to the mosque.
That's really smart.
That's good. Yeah. That's smart. One interesting development that happened yesterday or the day before was Prime Minister Justin Trudeau of
his wife
Canada his wife was tested positive. Yeah. She was in the UK delivering a speech, I think. And she came back and had flu symptoms. Yeah. And now he's in self-isolation. It goes to show that it doesn't matter who you are. Yeah. It doesn't matter, what you're dealing with. At the end of the day, anybody is susceptible to this disease, and it can happen.
Definitely. I want to talk about Iran some more because it's really scaring me. Watching the footage, people are only wearing surgical masks. I want everyone to know that surgical mask, it does absolutely nothing. Right? The only reason surgeons wear that during surgery, they don't want to cough. For example, if you're doing open heart surgery, you don't want your phlegm or cough to go into that open wound. Yeah. And so that's why they wear it. Right. Because it's open on the sides, it doesn't have proper. So people, I see them all the time here, by the way, in the train stations and walking around surgical mask. Guys, the surgical mask does absolutely nothing. Yeah. It's actually easier. It's actually the same thing as not wearing it. It does nothing, right? Unless you're wearing N95, it's not gonna work. So let's stop that. But we're seeing footage in Iran. They're all wearing that. No one's wearing N95. So they're kind of kidding themselves. Yeah. One thing I saw, and I don't know the legitimacy about this, but it was on CNN, was footage of mass graves in Al Qum. Which is this holy shrine. They've been digging mass graves, which is very scary, supposedly to dump bodies in it. Okay. There was also footage, again, on CNN and BBC of video footage of this warehouse and just all these body bags, hundreds of body bags, and it seems they're keeping it to be tested. And that's what's going on in Iran. It's very, very scary, and the fact that they have not canceled is really just, they're predicting the predictions about Iran are 80 to 100% of the population will get it, which is very scary. I'm glad the UAE and other GCC countries have stopped the flights.
Yeah.
Lebanon, sadly, my home country, only recently stopped the flights before, and then obviously there's close ties in Iran and Lebanon, and I'm worried about maybe the thousands of Iranians that went to Lebanon. I'm very worried about that situation. Obviously, my parents are there, and they're both over 70, so I'm keeping an eye out. But that's what's going on in Iran, and I think Iran is probably going to be, from what I'm seeing, and nothing's changing, it might be the worst country of all. Yeah, that's really, really scary.
It's sad to hear.
Yeah.
I also want to make it clear to our listeners and viewers that, we're not targeting any
we're not.
nation.
I'm just giving facts of what I'm reading.
These are what's out there and have been actually verified. So if a country is not doing its best to try to contain a disease, then we're going to call it out.
Yeah.
It's as simple as that.
I have a lot of Persian friends and stuff. I'm not trying to make you guys feel targeted.
Yeah.
This is just what the news is saying. And again, news can be debunked. I can be debunked. But this is just what's being said. But I've seen footage in Iran. And there's a lot of quotes out there from the supreme leader. And it's just, I really hope they start taking it seriously. Because I don't care about religion or politics, any of that. Yeah. I care about the people. And if they're not taking it seriously, then people are going to die. Yeah. And I don't care what religion or political group you're in. That's not good. Right? No one wants death.
Exactly.
So I really hope these countries take it more seriously. UAE has been doing some good job, even though I was looking at it in terms of between March 3rd and March 5th. In those 2 days, they looked at the top countries. Belgium was number 1. UAE was number 3.
In terms of growth?
Just in between those 2 days.
Okay.
Of new rates.
New rates. Yeah.
But I know the UAE has taken a lot of strong precautions. They've isolating all the cases to one hospital instead of spreading it out.
Yeah.
Obviously, banning of a lot of flights, which was super important, and
stopping schools.
Yeah, stopping schools, social isolation. A lot of companies are now being told to work from home. So I think this is going to help, and I think they're doing a strong. I think hopefully, what I'm saying, they're doing a legitimate effort to curb it.
Without naming any names, jumping to the United States, you know how they've stopped all these professional leagues now?
Yes.
The NBA,
Yes.
the NHL, NFL, I'm not sure of. But
No, but I know the NBA for a fact.
So I saw a video of an NBA player.
I saw that.
Who was joking.
I forgot his
at
name,
a
though.
press conference. Me too. I'm not even going to name him. At a press conference, and he's acting like he's touching all these mics, and then all of a sudden gets up and goes, and then he gets infected.
Yeah. He released an apology.
No
He released an apology, but that's not funny, man.
Oh, there's no time to be joking
That's
around
not
about
funny,
that
man.
stuff.
Like,
People are
especially
fighting for their lives.
So he probably had it when he touched the mics because it
don't-
stays dormant.
I don't. Yeah, perhaps.
Says,
You're right. I guess
by
he
the way,
didn't know it, but he had
they're
it.
saying so you can have up to 2 weeks, and now sometimes they're saying 37 days. So he probably had it. So now I really hope that anyone touched the mics or put their mouth in the mic didn't get it, because then that's on him.
Yeah.
So yeah.
Seriously. I pulled up those graphs that we were talking about earlier.
Yeah.
And so people with existing conditions, serious ailments who die, right? 10.5%. This is as of 9th of March.
Okay.
10.5% of people that died are cardiovascular disease patients. 7.3 are diabetes. 6.3 are chronic respiratory disease, COPD or whatever. 6% have abnormally high blood pressure. 5.6 with cancer. And it's crazy to me that cancer,
Was on the
being
lower
such
end.
an immunocompromised,
Was on the lower end.
was on the lower end.
Yeah.
That's amazing. Perhaps it's because of just the spread and
Maybe.
how many more people have blood pressure or heart
Yeah.
disease than cancer, right? So that's probably the why. And then no existing conditions was 0.9%.
Yeah.
This is like 5 days ago.
Yeah. So ideally, it is if you're
gotta calm
healthy,
down. Exactly.
if you're healthy, even if you're older,
Yeah.
the chance of you getting are low. So the probabilities are in our favor.
Yeah.
Hopefully, they don't skew higher.
Yeah.
And
And one
please.
last thing I want to touch on is, okay, so mentions in the media.
Okay.
SARS, 56.2 million.
In all time.
Yeah.
Okay.
HIV, 40 million.
This is all time. So it's like, or do you know the
Google
date
News
range?
is a source.
Yeah.
I don't know exactly what
Okay.
what period of time this is talking about. But let's just take it with a grain of salt and say, from X to X.
Okay, fine.
And this is, let's just say that these diseases were out there for that period of time.
Sure.
56.2 million for SARS, 40 million for HIV, 23.2 million for MERS, 11.1 million for Ebola, 5.9 million for malaria, 5 million for pneumonia, and then the list goes on. 1.1 billion for coronavirus.
Yeah.
And it's only been, what, a couple months?
Yeah.
So the media is blowing this out of proportion, but at the same time, if you take it, constructively, it's for information
Sure.
purposes, right? It's to keep people aware. And
So I want people, because I'm getting so many people contact me because they know actually a lot of people, because they were asking me questions because I was telling them I'm recording a podcast, doing a lot of research, and the amount of misinformation is massive. The amount of people getting their sources from Facebook or WhatsApp groups or whatever is massive. Let's tell people if they want to learn, where can they go?
I would say the World Health Organization's website, the CDC. The Lancet is a journal. There's a lot of other very, qualified peer-reviewed journals that publish verified information and peer-reviewed information, evidence-based information.
Now, if you want to follow specific individuals and you feel you can trust them, there's some I like listening to. So, Michael Osterholm on Joe Rogan seems legit. I feel he is a bit morbid. I wonder if he's overly morbid, because I think when you're in that field and you see all the horrific things, maybe you become more negative. I don't know. But he seemed legit. You have Tim Ferriss, who is a very smart person, and he releases a weekly newsletter. He's been watching it very carefully. He actually also created a curated Twitter list of all the tweets that he feels are valuable. You guys can look at that. And you have Peter Attia, who's a doctor in the U.S. Even though it's not his expertise, he's done a very strong job of working with first-party information. And talk to people. So that's, if you guys want to choose instead of an organization, you want to follow specific people, these are probably people I would feel have the highest chance of being accurate versus others who are not.
One other podcast that I would recommend, which is to the point, facts versus fiction. And he's very articulate in the way he puts things and doesn't take sides, is Dr. Sanjay Gupta from CNN. He has one called Coronavirus, Facts versus Fiction with Dr. Sanjay Gupta. That's a good one to check out as well, I'd say.
Also, just to clarify again on Michael Osterholm, he was also promoting his book, which might make him a bit more biased, to make it more morbid, to sell more copies. So just take that as, you know what I mean? I don't think he was making anything up, but obviously I think he probably, I felt he was maybe overly morbid. Maybe that's just his personality. Anyway, I think that'll be good. This is a bit longer than usual, guys. I think we're at around 50 minutes, but we wanted to make sure that we pass all the facts we found. We tried to go to the sources we feel were legitimate versus the sources we were not. So please do, if you feel that we said something that was wrong or might be proven wrong later on, please let us know. We'll go back and correct it. It's about learning, and it's about sharing our thoughts and what we have found. So this is part one. So you'd like to add a point?
No, I just wanted to say, man, everybody needs to take their own precautions.
For sure.
Everyone has family members or people that they know or love that are older or in the more vulnerable group of prospective patients. So do your part. Keep clean. Stay away. Try to socially isolate. Make sure you're cleaning. Make sure you're teaching the youth, your children, or any other kids around you, how to properly hand wash, how to sanitize, and the benefits. I mean, you're not trying to make germaphobes out of kids.
No,
you're
we're
just
not.
trying to keep them safe. That's it.
I'm trying to be. I always like to try to pull like some positives out of every situation. Maybe the way I look at it, I'm going to take it from my personal point of view, is that hopefully this lets people understand that in more pandemics in the future, we need to be more prepared. Maybe this is a wake-up call to humanity. And I hope we can now take the steps to mitigate any kind of these things in the future, because one day we might get a disease that is worse than the Spanish flu or like the bubonic plague. Maybe it's not this time, but maybe the next one is, or the one after that. So maybe it's a wake-up call to all humanity. So that might be a positive out of that.
It's not a task. It's an opportunity. Think about
100%.
it. Businesses can now open up and profit from helping mankind in dealing with these epidemics or pandemics.
Another one is, I would say, is that I think organizations are probably going to see the positive outcomes of letting people work from home. Hopefully this will
learning.
Hopefully this will actually change. There's been many countries and companies in the world for a while now have been doing like shorter working hours or less working days or working from home. But I think the impact maybe will show other companies that, you know what, maybe people work from home can still generate ROI, and we don't have to stick to this rigid work culture we've had for beginning of time. So maybe that's a positive.
It brings families together too. Think about it. Think about how much more time people are going to be spending with their wives.
And I think general hygiene.
Husbands.
I think general hygiene, right? I think in general, I think we just all need to be just more, clean and more healthier. So I think this is maybe a wake-up call for all of us on all these points. That's how I'm trying to take it. I hope it doesn't get worse, and I hope everyone out there, please do the due diligence. Don't spread fake information. If you see something on Facebook,
Yes.
don't go tell your mom about it or your brother or your friend, because you might be spreading wrong information. Verify it.
Make
It's okay.
sure you know where the
So
source
quick
is.
Google search,
Yeah.
all right, and then I think could really help. Listen to experts. If you don't want to listen to us, go listen to experts. I think just do the due diligence, and I think we can all, be
Survive.
safer and happier and survive. Anyway, guys, this was part 1. We're now now the next episode will be part 2. We're going to focus on more business side of things, the businesses that were impacted, businesses that profited, economy. So that's a bit more on the business side. So if you got to listen to that, please do. And then part 3 will be focused on the conspiracy theories. Let's kind of debunk or talk about, or even agree if we do, with some of the theories out there. And that's it, guys. This is The Tangent. I'm Digital Who's. He's Yas. Please subscribe. Check us out on Instagram and on YouTube, Spotify, Apple. Make sure to subscribe, drop us some feedback, and be safe, everyone.
Every
We're out.
generation is moving, is progressing. They want to do something other than what has already been done.
Beyond only what you think, huh?